What's the difference between a psychopath, a narcissist, and an avoidant partner? In today's episode, I'm joined by psychologist Dr. Maika Steinborn to break down the myths, explain the science, and help you understand what really matters for your relationships. We hear the words narcissist, psychopath, avoidant used everywhere online these days, often misused and misunderstood. Why do you think these terms have become so popular in everyday conversations about relationships?
There's this therapist called Epstein who said, like, he listed a few couple of core emotional needs we all have. And one of these is a need for control and orientation. So we all want to know what's going on in my life, what's
Mhm.
coming ahead, what can I do to influence it? Researching these kind of terms and then getting familiar with them is kind of what people, it helps them fulfill that core need for control and, yeah, understand themselves and the people they're dating or married to better. So I think that's like the main thing behind it. There might also be, like, a darker side to it because obviously it's easier to blame somebody if you have a term to use,
Mhm.
and then you can kind of focus on them rather than on yourself, but I like to think that most people probably do just wanna increase their level of control and orientation.
That makes sense. And it's really sometimes about that fear, isn't it? That fear of being hurt and that need, that strong desire to feel safe, which is completely understandable. From a
Mhm.
psychologist's perspective, why do you think it's so important that we clarify these differences between these terms?
Well, behind these terms, there are very different psychological patterns, and that determines in when they show up, how they show up, what kind of problems they create, how hurtful they can be, and
Mm.
also what kind of interventions are necessary to change something about it, how malleable they are. And so it really has a lot of consequences which of these terms applies to somebody. And that's why we have to be really careful about picking the right one.
Absolutely. And I think one of the things I've found is that it really sometimes can shut down that opportunity for a healthy relationship when people are quick to diagnose a particular behavior that maybe is a little bit selfish, but may not be necessarily a personality disorder or a sort of, a trait that we might see in a domestic violent type context. I think that people are really fearful of those type relationships, which is understandable. But I think often we're quick to jump the gun and mislabel situations. I wonder
Mhm.
if that's sort of been your experience as well.
Yeah, I mean, I see it especially on just on the internet, people saying I just using those terms lightly and quickly.
Mm,
In my own practice, not so much. Usually people who wanna speak with me do want also my perspective and want to hear what I think what it could be. So, I think, yeah, I've seen both people being careful with it, but also people being pretty quick to jump to conclusions about these terms.
I think that's such an important differentiation, isn't it? Like the social media kind of context that we
Yeah,
see
yeah,
versus the relationships that we have one on one with people, or for
yeah,
me, one on two with people in a room. Because I know, going online and seeing in forums that people are posting about their relationships, and then everyone might be kind of quick to jump in and
mhm,
label particular behaviors as, maybe that saying something like that person's narcissistic or that's abusive without understanding the full
yeah,
context. And
yeah,
I think when we do that, it can, really restrict that opportunity for change, both in the relationship and also for that individual. Obviously,
yeah,
in the same sense, we don't want to stay in relationships that are unhealthy for us. But I think that we've become a little bit too quick to kind of jump
yeah,
in and judge
but
a
yeah,
context that maybe we don't fully understand yet.
and what is your experience? Do couples come in and say, "Hey, my partner's a narcissist. I want you to help us clear up this narcissism?"
So I'm sure, similarly to maybe what you experienced in individual therapy, that someone may arrive in therapy not understanding that context or that struggle that they're having.
Mhm,
And it's really about, I guess, more about digging a little bit deeper, not just a diagnosis, but understanding the behaviors and the patterns that we might see in
yeah,
relationship contexts. It's really
yeah,
important.
mhm,
One of the other misused terms we hear is sort of this term psychopath being thrown around with people referring to individuals who they think have narcissistic personality disorder as psychopaths. What's the difference between a psychopath and a narcissist?
So a psychopath is somebody who would get the diagnosis antisocial personality disorder from a clinician. And that's like an umbrella term which also applies to psychopaths or sociopaths. And psychopath is kind of like the end of that spectrum. It's like the worst case you could say of somebody who being very impulsive and not regretting mistakes, hurting others, abusing others. So usually only forensic therapists or psychologists work with psychopaths or people with antisocial personality disorder. Usually those aren't people that will reflect on themselves and say, I need therapy. That is really a very different diagnosis and a completely different term than narcissism, which is a totally different diagnosis and profile. And narcissism is more about somebody having low self esteem and then compensating with those narcissistic patterns. That would show up differently. So, a narcissist is somebody who will make others feel inferior often so that they can feel superior, or who needs like an affiliation to special institutions or people who are special and makes them feel like this is me, my unique self. They can there are some similarities. Both can manipulate and gaslight and lie,
Mhm.
but the reasons will be different. And for the narcissism, it's more about this upvaluing of their own self esteem, and for a psychopath, it's more of what kind of a benefit can I get from this person? How can I extort them or without me having to really contribute to the relationship?
I'd say a lot of people listening wouldn't have heard that term antisocial personality disorder. And it's interesting for us when we're on social media and we're hearing people quite often use the term psychopath, that people may not be aware that that's not a diagnosis that would be made. It would actually be antisocial personality disorder. Can you tell us a little bit more about antisocial personality disorder and what that looks like?
So often this already starts in childhood. A lot of those questions to diagnose that, they're about what did that person do in their teens and before that. And so those are people who will already start being criminal in a way as kids, or maybe
Hmm.
even abusive to animals, and or like set a car on fire. Those are the kinds of things that would already be present in their biography to some extent. Of course, those are things people can hide. So if you meet somebody with antisocial personality disorder as an adult, those aren't things that they would just lay open. They would hide these kind of criminal things from the past. And they can be superficially charming in the beginning of a relationship, and then it turns. At some point, they'll just, do stuff like use people's credit card without permission, or steal somebody's identity, or move in with them but not contribute to rent payments, although that was agreed on. So, yeah, it's quite a high level of abuse and extortion that's going on there.
Mm. So it's very different to narcissistic personality disorder, isn't it? Like, there's obviously a lot of crossover, which I'd like to unpack a little bit more, and there's differences there. But one of the things that I heard you talk about when you were talking about narcissistic personality disorder before was the idea that people have low self-esteem. And
Mhm.
I think that may be a surprise to a lot of people because obviously we know and we understand the behaviors that we see alongside narcissism, but what's actually happening underneath that and what that person's experience is often not talked about on social
Yeah.
media, or not, or misunderstood really. Can you unpack that a little bit more for us?
Yeah, yeah, so the myth would be that a narcissist is somebody who's always confident, a bit full of themselves, and not afraid to kinda speak out in a room and to take over, take charge, be dominant. It could look like that from the outside, but the truth is that narcissists actually go back and forth between this grandiose sense of self of, like, "I'm special, I'm more important, I'm entitled, I have more rights than other people." But also then they have these depressed phases where they switch into totally different mode of doubting themselves and feeling insecure, which they might not probably won't show, or you could only get an insight into if you know them very well and you can kind of tell, okay, this is going on again now. They flipped to this other side. That's one of the big misunderstandings, that it's not about people loving themselves too much, but actually about one of the most fragile senses of self. And often they're not in contact with their authentic self at all. They don't even really know who am I actually? And because for all of their life, it's always been about who could I be if I were to be very impressive, and then trying to be
Mhm.
this impressive persona instead of just wanting to figure out which job actually is a job that resonates with me, or what are hobbies that I like pursuing instead of what are hobbies that will make me look good.
Mm. And I think something else that's misunderstood is that, often we do see a lot of trauma in childhood with people who have narcissistic personality disorder. Could you talk a little bit more about that?
Yeah, I mean, disorders don't just come from nowhere. There's debate, which debates about is it more nurture, is it more nature? And nurture plays a significant role. We can say that much definitely. And often narcissistic people or people with narcissistic patterns or NPD had very traumatic childhoods, were neglected, or often they can also have had a narcissistic parent themselves who kind of raised them to be somebody who will be impressive and that they can kind of brag with. So, hey, this is my great child. Only gets A's in school and excels at everything the child tries. So that's kind of usually how it starts. It starts really in early age, or they might the parent might already try to get the child to know the alphabet when they're like 2 years old or something. And it's very much about performance and good
Mm.
grades and achievement, and that kind of a pressure to be somebody they that your parents can brag with. That's kind of what starts this differentiation between, or not differentiation, even just putting aside the authentic self and developing this persona.
And these ways of coping, really, isn't it? And we think often about those
Yeah.
coping modes that people might have when they
Yeah.
um, have grown up in those kind of contexts, which may have been adaptive back then, but are now maladaptive, particularly in their
Yeah.
relationships. Yeah.
Exactly, right, yeah. Yeah, like, a child depends on their parents, so a child will do anything to please their parents, and if the child's parents are pleased by achievement and, a flashy persona, then that's what the child will develop.
Mm. And one of the things that we hear a lot online when people are talking about narcissistic personality disorder is this idea of like once a narcissist, always a narcissist. Narcissists will never change. I want to hear your thoughts on that.
There's no way to say this for somebody to be, "Okay, this is the prognosis for me." Obviously, I can only say a
Hmm.
general statement, and then each individual case will be different. But it is possible for narcissists to change. It's not like it's completely impossible, or, like, yeah, they're born that way and that's that. That's a very, like, fixed mindset way of looking at it, but there is growth is possible for narcissists, and, the question is just how much effort it would take and how much willingness, and that needs to be quite high. So they would need to invest effort, they would need to be willing to change, and also they would need to be able to reflect on their own narcissism, and that's sometimes problematic. If they're very identified with it, they won't see that they're being narcissistic when they're acting in narcissistic ways, and then that's hard. That that's kinda where you hit the, border of it being hard for them to change.
Obviously, with that type of presentation, it makes it even more difficult to step inside a therapy room. If we talk about that fragile sense of self, that
Mhm.
often a lot of those grandiose behaviors are really trying to protect that self image.
Yeah.
When the
Mhm.
idea of going into a therapy office, I mean, it's not what we want people to think, but often people have an idea about going into therapy being there being something wrong with you.
Yeah. Yeah.
So that very idea in itself can be an enormous barrier to someone seeking
Yeah.
treatment and support.
Yeah. Yeah, definitely. So being like, needing therapy could be like an admission of fault already which is
Mm,
really hard for somebody with narcissistic patterns, because that's the least thing they wanna, uh, acknowledge about themselves, that they're human and make mistakes like everybody else, and that
mm,
could be really tough for them. Or, I mean, often I think what's if somebody isn't willing to recognize their narcissism, I think often what happens is they will go to therapy, but then spin things in a way that it's all their partner's fault or everybody else's fault. They won't really be able to reflect on how am I contributing to what's going on in my life.
how can we tell the difference between, just some of those more selfish behaviors that we all have at times that we might see in relationships versus someone who might meet criteria for narcissistic personality disorder?
Well, the more somebody so it's a spectrum, that's a good thing to point out, and we are all somewhere on that spectrum, and everybody has used narcissistic coping at some point or other in their life, if we just break it down to what those behaviors are. The further somebody moves along the spectrum towards NPD, the more intense these behaviors will become, the greater the variety of the behaviors will be there. So somebody who's self-absorbed might only have this one trait or another trait of narcissism, but someone with NPD will have many of those traits and to greater intensity. So somebody who's just being self-absorbed might have a stressful life situation. So on that day in the evening, they might act in a self-absorbed way. But somebody with
Mhm.
NPD, it would be a more pervasive pattern. It wouldn't just be one night. It would be coming up more frequently and more intensely. Also, I think somebody with NPD, the contrast between their out of home persona and within home persona is greater. So within their house, they could have rage fits and be very downtrodden, but then outside suddenly everything's fine and their life is going great. Whereas somebody who's just self-absorbed, probably their mood will be pretty much the same. Like they're not that good at hiding it. And they wouldn't have such a intense outbreak of rage also.
Mhm, in the workplace and can
Yeah.
obviously be very high functioning in,
Yeah.
in workplace roles. It's interesting because, like, as a couples therapist, I see often we see more presentations of NPD in couples therapy than I probably did in individual therapy. And obviously, we know that relationship difficulties, as you're highlighting, can be a key component of that presentation. So it makes sense that we are seeing more people struggling with that in the relational context. The other thing I see often conflated is, interestingly, NPD and avoidant behaviors, which could obviously be avoidant PD or avoidant attachment, which we'll unpack in a moment. But can you tell us a little bit about the difference between avoidant behaviors and narcissistic traits?
Yeah, so avoidant behaviors come from attachment theory, which, was, yeah, developed by Bowlby, and it's a great theory. It's very helpful. Couples therapists use it, but it's not a diagnosis, so that's, like, the first different. NPD is a mental health condition, and avoidant attachment would be an attachment style. So somebody with NPD could have an anxious attachment style or an avoidant attachment style or a disorganized attachment style. They probably won't have a secure attachment style, and whereas somebody with avoidant attachment style, they always have obviously have an avoidant attachment style. So somebody with NPD can act very they could also have an avoidant attachment style, and that's kinda where it gets tricky, to separate all of that. But avoidant attachment is more about somebody pulling away when the commitment grows in a relationship or avoiding conflict, being dismissive of feelings and vulnerability, not only in their partner, also in themselves. These types of behaviors, whereas people with NPD start very quickly, so they'll jump in quickly, and so there's not this fear of commitment if it's just purely NPD. The abuse is more hurtful to their partner's self-esteem and how they feel about themselves, how much they trust their own instincts, whereas with avoidant attachment, it doesn't run that deep into that direction.
That makes a lot of sense. Interestingly, I hadn't really thought about the initial part of a relationship, but that makes a lot of sense. And people obviously are very familiar with the term love bombing with narcissism, but that in avoidant personalities, we may actually see someone step back a lot more in
Uh-huh.
that initial stage of dating.
Yeah.
And obviously, also the behaviors that we see over time are very different and come from a very different place, whether you're talking about avoidant personality disorder or avoidant attachment. Can you break down that difference between avoidant personality disorder and an avoidant attachment style?
Yeah, so, again, one of them is a diagnosis and a mental health condition. I mean, the avoidant personality disorder, and the other one is an attachment style. Although, of course, the avoidant personality disorder is there the attachment behavior could be quite similar, although it's usually more severely avoidant. So somebody with an avoidant personality disorder might avoid dating altogether, and it
Mhm.
also affects more areas of their life. So if at work they get invited to do something that could be really good for their career, but it could risk rejection or being seen by others in a way that exposes them, makes them vulnerable to criticism. they would also avoid those kind of things, whereas somebody with an avoidant attachment style usually isn't affected at their workplace or all these other areas of life.
That's such a good explanation because I think it's so important to see that difference between like what's happening in the relationship and then the broader context that we might be experiencing.
Yeah,
Why do you think it's so important that we don't conflate things like attachment style with personality disorders?
because different interventions are required, so, yeah, it's just confusing or it just confuses it's and it would be mislabeling somebody, then they probably wouldn't get the help that they need,
Mm.
and another thing also, it stigmatizes people, so even if I would even suggest that if somebody thinks they know someone with NPD or an avoidant personality disorder, that they don't go around saying that to people if they're not a clinician, and that's not like a therapist-client relationship because it stigmatizes people and it can actually weigh down on their motivation to want to change or just to see that how that change is possible if it's just used because often people use personality disorders like stamps, like you have this flaw, you're broken like this, so people should avoid you and just set you into put you in a rocket and shoot you to the moon so nobody ever has to like talk to you again. And that's very, I think it can be very
Very
devaluing.
harmful.
Yeah.
Mhm.
Yeah. Yeah. It's not that helpful. It's like it's devaluing and demotivating to people.
Mm. And as you said, like it really impacts that pathway to getting the support that people need. Why do you think people do this? Like, why do you think people reach for these labels so quickly, like narcissist or avoidant, instead of describing behaviors more directly? Which, I think even when people think about psychology, they often think that we're just focused on like the diagnosis. And it's
Mhm.
such a small part of what we actually do.
Yeah.
And, when we're talking to clients, it's really not about focusing on, I mean, sometimes obviously we'll talk about diagnosis, but it's about understanding their unique the situation, like their unique circumstances, and understanding, what maybe has contributed to them arriving at where they are today, what's perpetuating those kind of behaviors, what can help change those behaviors. So obviously that behavior language is so important and it helps us to kind of separate out the person from the behaviors that we can see and the behaviors that we can change. Why do you think that people struggle to talk about it in those ways where we're so quick to label something?
I think our brains, they wanna conserve energy. So and one way the brain does that is by stereotyping and putting things into boxes and in scripts. So that is just something all of our brains do is that they like pattern recognition, and it's a lot
Mhm.
easier to just put things into boxes. But the problem is that then the differentiation gets lost and, um, yeah, we might be very, very wrong about something.
Mm. I'm just thinking when you said that, I'm thinking about how many like checklists we see on social media and how quick we are to kind of like identify
Yeah.
like one key trait and label that. Um, and as you said, because it simplifies things, it keeps things simple. We all
Yeah.
want to feel like we're in control of what's happening in our world. And we feel like if we can, really simply kind of tick a few boxes and put someone in a category, then it's easier to maybe keep ourselves safe or it's easier to understand people.
Yeah.
But we're lacking that deeper understanding, aren't we, of what's really happening for that individual and
Yeah.
how we can move forward with them.
Yeah. Yeah, I think that we can end up being scared of something or insecure about something we might not actually have to be as scared of, by just
Mm.
slapping these very strong labels onto people. Mm.
What do you think are the risks of over pathologizing normal relationship struggles?
Mm. I it it demotivates and destroys hope for the relationship. If if what would need to happen for change to take place is a huge thing, then people might not wanna be motivated to get started seeking help or starting their own growth journey. Pathologizing makes problems bigger than they are, and who and being motivated to address a huge problem is a lot harder than being motivated to start working on problems that are kind of, yeah, smaller and easier to tackle.
And feel more achievable. And
Yeah.
yeah, it's a lot easier if someone's sort of pointing out behaviors that may be unhelpful in our relationship, then saying, "There's a problem with you. You are the
Yeah.
problem, and you need
Yeah.
to change who you are,"
Yeah.
which is, as we know, kind of an impossible task
Yeah. And it
to
creates it
change our temperament, but we can change behaviors.
yeah. And it creates even more shame in people, which is usually a lot of problems people have can be boiled down to shame and low self-esteem.
Mm.
So just piling on to that and saying you're not, like, fundamentally down deep in that core where you are situated, there's something wrong there, then that makes people wanna hide and avoid their problems and avoid life and relationships and not jump out and say, "Hey, I can do this."
Absolutely. How can someone listening use attachment science and psychology in helpful ways without falling into that trap of labeling?
I I think what's really important is to hold your hypotheses lightly. So if you have a hypothesis that something might be going on with a certain pattern, to also ask yourself, well, what speaks against my hypothesis? What speaks against that somebody is um whatever label you're thinking of? To really have that differentiated look at it. And also I think it's important to use psychology and attachment theory to reflect on yourself or to co-reflect with your partner and not to
Mm.
blame others and only demand that another person change.
That is so important.
Mhm.
That's such a huge takeaway, isn't it? Because I think, we can commonly see obviously someone pointing the finger in their partner's direction and not seeing the dynamic, that plays out often in relationship. It's quite often a pattern that we're caught in, which
Mhm.
may be around our attachment style, maybe around deeper unmet needs that we have. It may be around a number of things like how we respond to conflict. But, understanding those patterns really does require us kind of looking at ourselves and understanding the role that we play in that. So that's such an
Yeah.
important
Yeah.
point, I think, that you just made there.
Yeah. Mm.
If someone's genuinely worried about their own behaviors or their partner's behaviors, what's the best next step for them to take?
Mm, I mean, if it's a genuine worry about something deep, then I think we're beyond the point of self-help, and then I would suggest seeking out a professional and just getting their opinion on where you're at and what would be necessary to change that. And yeah, you don't I think a lot of people try to solve their problems alone, and you don't have to. You can get help. And then often a selected professional intervention will bring you a lot further more quickly than trying
Mhm.
to kind of read all the books yourself and figure all these things out on your own.
It's very hard to do, isn't it?
Yeah. Yeah.
I think it's really important, and we obviously, you've got your YouTube channel where you're doing this. I'm doing this podcast for this reason, that we want to be able to get more into the nuance of what's happening and why, and give people strategies. But it's very normal to not be able to implement that, or kind of really to put that into your own individual context in a way that holds deeper meaning and that where you're able to take and implement real change with. So I think that's such an important point, is to recognize that even if you've read the books, even if you've done the classes, if you're able to implement that, fantastic. That's great. That's obviously, that would be a fantastic outcome. But if not, that's very normal. Most
Yeah.
of us do need individualized support to unpack some of those deeper patterns that we might have, or to understand why we might show up in particular ways at particular
Yeah.
times.
Yeah.
We've obviously pretty much this whole podcast has been on dispelling myths. But I do want to ask you, because I do ask all our guests this question: is there any myths out there that you would like to dispel, something you may have come across on social media or more broadly, out there in the world, that you would like to dispel?
Mm. Well, there's one thing that keeps coming up in my comment section, and it makes me sad for people who comment this, and those are comments like, "I'll never trust anybody again," or "My heart has been broken too much. I'm like, relationships are not something I'll ever pursue again." And so the myth behind that is that if you've been hurt in love or your trust has been abused, to then think that you're never able to love again or trust again, or that if you were to take that chance again, it would break you completely. So to dispel the
Mhm.
myth, I'd like to tell people that we're pretty resilient creatures and that if you give yourself time and a recovery phase, you are able to love again and trust again. And it's, worth it.
I love that because I experience that, as well, and it always breaks my heart too. Because I think there's, so many you may not have found the right relationship yet for you, and it may be out there, and it is often about building that together. I think
Yeah.
also people can have a myth around, they'll find the right person, but quite often it's about, building that relationship, that secure attachment together. So
Yeah.
I love that.
Yeah. And also, I think people can be too quick to trust, but also too mistrusting, and it's about finding the
Mhm.
balance there. Of course, it's important not to just trust every person that walks on the street, but the other extreme would be just to shut yourself into your apartment and never leave it again. So yeah, and that's the journey of life, is to find the balance there.
Absolutely. Knowing like who we want to step into vulnerability with and how we
Yeah,
do that in a way that's sort of safe for us, but also
yeah.
obviously can bring up some uncertainty and some fear, but having that willingness to be courageous.
Mhm. Yeah, yeah.
One last question for you. If you had a magic wand and you could impart one skill or piece of knowledge on all humans, what would it be?
I would like for them to have an experience of their own worth and lovability, because I think it would solve so many problems for them, and uh, not overextending themselves and being authentic and pursuing a life that they find meaningful, and not and all the also a lot of the relationship problems would um, not be such a hard issue, or not an issue at all, if people had that experience of their own worth and lovability, and they wouldn't need to be hypersensitive to rejection or pull back and conflict and all of those things that make relationships hard.
Absolutely. It would be such a beautiful foundation that we could all have, wouldn't it be?
Mhm, mhm.
Thank you so much for your time, Micah. I really appreciate it. I've wanted to do an episode like this for some time because I think there is so much misinformation out there. And, the purpose of this isn't obviously to increase the people sitting out there ticking off the checklist, but really to bring awareness to, the differences between these things and how normal it is to have things like avoidant attachment styles, for example, and struggle in relationships, and that change is always possible, if we can seek the right treatment or the
Yeah,
right help or the right
yeah,
support that we
yeah.
need.
I think a lot of avoidants that I work with, they think that they are the enemy or the problem, and that's a huge part of the relationship dynamic of the typical anxious avoidant trap. So, yeah, I think it's really important to not vilify avoidance like that on the internet. And
Absolutely.
yeah.
And it's become a beast unto itself, hasn't it? Like it's
Mhm.
just it's almost mind blowing to me because what we know and what I obviously see in couples therapy is how common avoidant attachment is.
Mhm.
So we know roughly 25% of people experience avoidant
Yeah.
attachment, for example, and how common that kind of dynamic is where one person will pursue and one person will withdraw. We probably see that in 80% of relationships. So a lot of these concepts that people are grabbing and running with and vilifying one partner around their set of behaviors in that are actually really quite normal struggles that most people will experience when we're talking
Yeah.
about those attachment behaviors.
Yeah.
So I think it's so important to have these conversations because I think that people are at the first sign of any insecurity, kind of misunderstanding or mislabeling what's happening, either in themselves or in a potential partner or a partner. And it's really getting in the way of people creating healthy relationships and a lot of healing that can be done in those relationships. So I think
Yeah.
these conversations are so important. So thank you so
Yeah.
much.
Yeah. Thank you for having me. It was a joy. And yeah, I was happy to talk to you and discuss these things. And sometimes I had the feeling my tongue got a bit twisted, because it's really hard to differentiate all these things. And sometimes
Yes.
but I hope that the listeners can kind of get the main points, and understand the main differentiations, and see, you know, that it's always worth looking for support and help and growth.
Absolutely. And I know you have a fantastic YouTube channel,
Oh,
which is how I found you.
thank you.
um, and I think it's so important that people access resources like that because, we can have these conversations, but it can take a moment to kind of sink and reflect. So, can you share um, how people can find you? We'll obviously put it in the show notes, but if someone's driving along at the moment, listening in, where can people find you?
Yeah, they can. add my name into their search engine. It could be Google or into YouTube. And that's Maika Steinborn. So Maika and then Steinborn. And then you'll see all my videos come up, and you can browse to my playlists. It's kind of my way of organizing my videos for different topics. So you can also see like what specifically interests you and which playlist might be relevant to you at this point in your life.
Definitely check out that YouTube channel because there's so many fantastic resources on there. Thank you so much, Micah.
Thank you. Thank you. Have a good day.
Subscribe for more conversations filled with new insights, inspiration, and practical tools to create a life you love.